We've got 72 participants logged in on Zoom, and we've got a number of folks also in the room here in New Brunswick. So I think we can get started with our welcoming remarks.
Great. Hello, everyone. I'm Renee Carniel, Director of the Grata Fund for Older Adults. I'm here as well with Julia Stumbos from the Henry and Maryland Howe Foundation. And of course, on behalf of the Age-Friendly North Jersey Alliance, the Rutgers School of Social Work and the Hub, and other elements of Rutgers, I want to welcome you to today's program. Our program today, Engaging with Your Local Government Through Municipal Committees on Aging, is a hybrid event for community leaders, service providers, and New Jersey residents who want to create age-friendly changes in our communities. The event will feature presentations from our Rutgers School of Social Work team on their municipal committees research, and from New Jersey community leaders who will describe their work creating and maintaining committees on aging in our municipalities. I'm thrilled that our speakers are going to share key information about what it means to be a municipal committee on aging and how each of us can establish and maintain such a committee in our own municipalities. Most important, our speakers will explain the power and impacts of committees such as these to create positive changes in our communities for residents who are older adults and that will benefit individuals of all ages. Thank you. I send this back to you, Althea.
Thank you, Rainey, for your wonderful introduction. If we can go back to the schedule slide, I'll walk everybody through what to expect from the afternoon today. So first, we have some additional welcoming remarks from our host organizations. We'll go through some notes of housekeeping. Then we have a presentation from the Rutgers team, followed by 2 presentations from speakers from local communities in New Jersey. We'll have some general question and answer and time, and then we'll have some time in breakout rooms together, followed by some closing remarks with an exit poll. So we do hope you'll be able to stay until 4:30. Go to the next slide. So happy Older Americans Month, everybody. May is Older Americans Month. The theme this year from the administration on community living is Aging Unbound. So this program today is intended to be part of that celebration, bringing people across different contexts and geographies in New Jersey through civic engagement education. And now I will invite my colleagues from our host organization physically here in New Brunswick to say a little bit about their organization.
Good afternoon, everybody, and welcome. Welcome to our Zoom participants. Welcome to our wonderful in-person participants. It's great to see everybody. I'm the director of our Osher Lifelong Learning Institute here at Rutgers University. My name is Megan Novak, and I couldn't be happier to join everybody today. I am delighted to be part of this program. We offer non-credit personal enrichment programming to older adults than 50 and better. So we offer recreational courses from math to science to English to art, anything that you might have wanted to take and you didn't have the opportunity to take, and you want to engage with that now. So thank you for joining us today. I hope you join us on our journey at some point. And please let me know if you have any questions. Thank you.
Great, thank you, Megan. And I am here, my name is Althea Pestine-Stevens, and I kind of wear 2 hats from 2 of the host organizations here as well. We already heard from Renee Carniel from the Grata Fund, who is also on our leadership team for Age Friendly North Jersey. So that's one of my big hats that I wear in my position at Rutgers School of Social Work Hub for Aging Collaboration. So we coordinate professional development, networking, all sorts of learning and advocacy opportunities for age-friendly leaders in the northern part of the state. So what age-friendly community leaders are people who are in any sort of community. It doesn't have to be, it's not necessarily a residential, older adult residential community. It could be any community. It could be your town that you live in or your county. And people who are local grassroots leaders, volunteers, older residents, nonprofit leaders, local municipal government workers, business, people who work at businesses and own businesses too, are trying to make the environments better for people of all ages, but especially for people who are getting older, to be able to continue to thrive in their communities of choice. And so that's what we do as age-friendly communities and as our network, our alliance of age-friendly communities. My other hat is at the Rutgers School of Social Work Hub for Aging Collaboration, in which is newly formed. So this is our launch semester right now, led by Professor Emily Greenfield, who's also on this call today. And we're a network of researchers and staff and students and leaders within the School of Social Work at Rutgers that are working to improve the social context. Yes.
I'm so sorry to interrupt. I want people to know you might have gotten a private message from somebody about recording the meeting if you're on Zoom as a private message. We're not sure who that person is and they're not here anymore. So please disregard it. And we do not advise you to click on the link that they sent. We will send a recording of the meeting to all the registrants by email and just ask you to disregard whatever was sent in a private message to you through the chat. Just wanted to say that. Proceed, please. Thank you.
Okay. Thank you. So we're a network of scholars, different professors at the school, as well as students who are learning to be wonderful practitioners in gerontological social work, as well as doing community engagement and making connections across other departments of Rutgers as well, which this program was a wonderful opportunity to enhance that connection with the Osher Lifelong Learning Institute. I've got some postcards about the hub for people who are here in person if you'd like to learn more, and we're happy to put some links in the chat as well. So thank you. We can move on to the next slide. A little bit of housekeeping. Closed captioning is available. Thanks to Carl for figuring out how to make it available on our screen here in person. We encourage participation throughout the meeting. There will be some audience polls. Please use the chat to ask questions and add comments. There will be designated time to ask some questions orally. We will also have breakout rooms to ask more in-depth questions with the speakers. But when you're not speaking, we ask that you please keep yourself muted. When you are speaking, we do ask that you please turn on your video if you can. This helps especially with our participants who read lips to help understand what folks are saying. So please let us know if something is not accessible. You can message myself, Althea, Pestine-Stevens in the chat, or Emily Greenfield in the chat. Next slide has some instructions on how to enable captions. If you're not quite sure how to do that, you should see the CC button at the bottom banner. You can click on that caret to bring up the menu of options for captions, where you want them to be on your screen. Thank you. And next is audio and video instructions here. This is also the bar at the bottom of your screen. If you don't see the captions from before, you may have to click on the 3 dots that are on the bottom of the screen as well. But your audio and video settings should be right at the bottom left. You click on the microphone to mute or unmute. You click on the video camera to turn video on or off. And of course, you click on also those carets next to them to bring up the menu of options for audio or video. And with that housekeeping, completed, I would like to move on to the first presentation of our afternoon and hand this off to Professor Emily Greenfield for a presentation on municipal committees and leadership.
Thank you so much, Dr. Pestine-Stevens, and welcome everybody. It is such a pleasure and a privilege to speak as part of today's event. My name is Emily Greenfield, and I am a professor of social work at Rutgers, the State University of New Jersey, as well as the founding director of the recently launched Hub for Aging Collaboration. I've been on faculty since 2007 and have had the good fortune of nearly 15 years of experience working with on-the-ground leaders in the field of aging in our great state of New Jersey, many of whom are here today. So this is where I would like to begin my own remarks. What led our team at Rutgers to become interested in municipal committees on aging, and how might these reasons resonate with your own interests? Well, really since 2015, we've been working closely with individuals and organizations in New Jersey that are spurring the age-friendly communities movement in the Garden State, which is now largely organized through the Age-Friendly North Jersey Alliance. The first picture on the slide is a photograph from one of our Alliance meetings earlier this year. And as I imagine many of you are already aware, the Age-Friendly Communities movement seeks to make the places in which we live, work, and play more inclusive, supportive, and equitable for long and healthy lives. As also displayed on the slide, the Age-Friendly Communities movement focuses on various aspects of community life for aging well in our own homes and communities, including considerations of suitable housing, diverse transportation options, accommodating outdoor spaces, accessible community support and health services, robust communication and information networks, and the list goes on. Okay, so now back to our story in New Jersey. Our years-long project on age-friendly community initiatives in partnership with private philanthropy and community leaders across 6 counties in our state has served to fuel, to inspire, to inform, and to support municipal involvement in age-friendly work. At the same time, as researchers, we have been formally studying and writing about what makes age-friendly community initiatives tick. In short, how does social change for aging happen at the local level, especially through the lens of inter-organizational and cross-sectoral partnerships? Well, a few years into our work, we came to the insight on the importance of groups, interpersonal structures that serve to organize the voices, ideas, actions, and visions of various community stakeholders. Concepts like age-friendly core teams, partners councils, advisory committees, ambassador groups, these all became quite common lexicon among age-friendly leaders in describing the how and what of their efforts. But over the years, we've heard more and more about another type of group: senior citizen advisory councils, senior advisory committees, older adults boards. How do these groups, which in many cases predate age-friendly community work, fit into the landscape of municipal responsiveness and leadership for population aging? So as an intellectually curious and committed age-friendly research team, we decided to conduct a pilot project to better understand municipal committees on aging in New Jersey. And we are thrilled to share today what we have been learning with you all. Specifically in the next few slides, we will address the next few questions. First of all, what are municipal committees on aging? And second, how common are they in New Jersey? We'll also share some concluding insights at the end of our time. Okay, so what are municipal committees on aging? Let's take a step back and do a mini civics lesson to get us all on the same basic page. You may or may not be aware that New Jersey is made up of 564 municipalities, and these municipalities all have some form of local government. Local government is like a structure made up of interconnected parts. Hence the text on the slide that refers to municipal committees as part of the anatomy of local government. A major part of local government is its governing body, generally comprising a group of individuals who are elected by voters of the community at large. In many cases, we refer to this governing body as the town or the city council. Another part of local government includes municipal departments, which are generally staffed by professionals who are employees or on the payroll of local government. And yet another part of local government is, of course, municipal committees. There are many examples of municipal committees across New Jersey's 564 municipalities. Here, as stated on this part of the slide, are some examples: planning boards, recreation commissions, economic development committees, community relations advisory committees, and of course, the star of the show for today's webinar, municipal committees on aging. Despite the wide variety of issues that municipal committees can address, they generally share these two features. First, members are typically appointed by the governing body. That is, to become an official member of these municipal groups, individuals must go through some kind of process of being appointed by the elected officials who serve on the town or city council. Second, with notable exceptions, advisory councils and committees typically serve in an advisory capacity to the governing body, making recommendations to policymakers and liaising between the elected officials and the community at large, but not having the formal authority to make official decisions on behalf of the municipality. So now that we have covered the general concept of municipal committees, we can turn our attention to municipal committees on aging. In general, municipal committees on aging are at a very broad level exactly what they sound like. They are committees that are part of municipal government that focus on issues of aging. But through our team's collaborative work on municipal leadership and aging, we have come to understand that there seem to be two related yet distinct varieties or types of municipal committees on aging, as described on this slide. The first type is the longstanding model of senior citizen advisory committees, go by various names, but that's one common way of referring to them. Sometimes referred to as SCACs, or in the case of senior advisory committees, SACs. A hallmark feature of this type of committee is that they are largely comprised of older adult residents, people who are experiencing later life within the municipality and who have come together to engage in several key functions, which can include serving as a liaison between the local government, their peers, other residents, and other community groups, voicing concerns, ideas, and priorities of relevance for aging in the community to the governing body, and oftentimes planning and engaging in community programs like educational workshops, trips, and celebrations. But interestingly, there seems to be another type of municipal committee on aging emerging in the Garden State, especially as part of the growing age-friendly communities movement, and this is reflected in type 2, an age-friendly initiative committee. In contrast to the first type, these committees deliberately consist of both residents and key community leaders that represent different disciplines and sectors. For example, an age-friendly initiative committee might include several older adult residents, as well as a designated liaison from the town council, plus a municipal manager, key department heads, leaders of private nonprofit organizations, and members of other municipal committees, such as a chair of a municipality's Economic Development Commission. Age-friendly initiative committees, as part of municipal government, also serve in an advisory capacity, but do so perhaps in a more strategic, comprehensive, and planful way. For example, age-friendly initiative committees might devise a comprehensive list of community groups and organizations for strategic outreach and have members planfully meet with other community leaders on behalf of considerations of aging in the community. Theoretically, age-friendly initiatives also assist with broader age-friendly community initiative work, including the development of strategic action planning, assisting with the implementation of this plan. Age-friendly initiatives are also accountable for recording progress toward implementing action plans and reporting on the work to the governing body and other community leaders as part of their strategic outreach function. Now, keep in mind that this distinction between senior advisory committees and age-friendly initiative committees is more like an ideal type or a heuristic than a reflection of what municipal committees on aging in New Jersey actually are. So to what extent are municipal committees on aging serving closer to the first type compared to the second type? What does this mean for making New Jersey a better place to grow up and grow old? How can we support and amplify the efforts of these committees in light of the composition of their membership and their key functions? For our research team, these are all very important and relevant empirical questions. So to begin to answer them, our team learned that we first needed to figure out just how prevalent are municipal committees on aging in the first place in New Jersey. Because we're not aware of any centralized list or registry of municipal committees on aging, we decided as a team to look up and piece together this information ourselves, a project that we describe in the next few slides. So I'm now going to turn the mic over to Annabess Ehrhardt, a very, very soon to be graduate of the Rutgers School of Social Work MSW program, a Taub Fellow in Aging, as well as an incredible and valued member of our research team over the past 2 years. So Annabess, take it away.
Thank you so much, Dr. Greenfield, and thank you to everyone for being here today. It is so great to have you here. And yeah, I'm like Dr. Greenfield said, my name is Annabess. I am very soon to be a graduate of the MSW program at Rutgers University. And I've been working with this research team for a couple of years now. So you know, as one of the primary graduate assistants on this project, I figured it would be good for me to tell you just a little bit about the specifics of what we did to collect this data. So, it was myself and a team of other research assistants who we were just sort of digging through the internet to find evidence of these types of municipal committees on aging in all 564 municipalities of New Jersey. And important to note that, we were not looking for advisory boards that were, part of specific departments. So for example, an aging advisory board for a rec department or something like that, or senior centers. So specifically just a municipal committee on aging. We had a list from the New Jersey State Library that listed all of the municipalities by county. And so in a couple of slides, I'll show you an example of one of the counties. We kept all of the data organized by county. And really the way we started was just going into the municipal websites. So most municipalities, not all of them, but a large majority do have their own websites. And typically they're pretty good. They're pretty clear and well laid out. And so that was typically the starting point for finding the information that we were looking for. And we certainly did find quite a few that had, detailed information on aging services, which included sometimes municipal committees on aging. If we were not able to find any evidence of municipal committees on aging from the specific municipality website, then we would take it to a more broad Google search. So, typing in terms that hopefully would be more likely to populate with that information, such as, whatever XYZ town senior advisory committee or senior advisory board, things of that nature. So that was the way we did it. We tried to be relatively in depth. It's obviously it can be a bit limited when you're only using the internet, but we certainly got some helpful information. Dr. Greenfield, if you'd like to go to the next slide. This was just a screenshot from one of the websites of one of the municipalities. I thought this would be a great example to show you all. So, we'd go into the website. And you can see at the top of the page there's a whole bunch of tabs. You see government, departments, boards, residents, etc. And so this is a great example because if they had a section specifically for boards and committees, councils, commissions, things of that nature, that would typically be the starting point on the website. And so this is a great example of, you can see you go to boards and right there you find senior advisory or senior citizen advisory, excuse me. Some other websites you had to dig a little further. Sometimes you'd go into departments and then aging services, and then, it was a little bit more convoluted to get there. So some of them required a little more digging. But most of the time, if we were able to find that a municipality had a committee on aging, we would typically find it somewhere on their website. And if you want to go to the next slide. So lastly, this is just an example of what, how we were recording the data. So, we again did it by county. You can see this is Middlesex County. And so we listed all the towns again that we got from the list from the New Jersey State Library. And we put down almost as much information as we could find. We really wanted to know, total population, what percentage of that population is over the age of 65, and then, whether or not they had a municipal committee on aging or something similar, and then also other related committees or, groups, senior centers, things of that nature. So it was a really thorough effort, and I was glad to be a part of it. So thank you for letting me share, and I will turn it back over to Dr. Pestine-Stevens.
Thank you, Annabess and team, for all of your hard work on this project. I do want to report on the findings of this project, but I also want to make sure we get to the good stuff, which is hearing from the communities that do the wonderful work on these projects. So I'm just going to provide kind of a taste of some of these findings. Overall, we found that 71 of New Jersey's 564 municipalities had committees on aging. it was common to have the term senior in the name of the committee in their title, such as a senior citizens advisory committee, a senior advisory council, senior advisory board, or a senior committee, with one very notable exception, which is a community that we will hear from later this afternoon. So moving on, which county in New Jersey do you think has the most municipal committees on aging? And we can launch the first poll.
Essex County?
We've got some folks saying Essex in the room here.
Bergen.
Some Bergens, yeah.
Covered Essex County, Passaic, and Morris.
And if you already know the answer, because you peeked ahead, just say what you thought it would have been. All right, we can share the results. So it looks like people mostly thought Bergen, Mercer, Middlesex, Ocean had the most amount. All right, we can move on to the next slide and see if that was true. So here's a map on the right of all of the that we found, of course, in our scan of all of the communities that had these. It's possible that we may have missed some in this part, and if you think you might not be represented and you should be, let us know after the meeting. So Bergen had the most number of communities with municipal committees on aging, 11, but they also have the most municipalities. So only 16% of theirs actually had them. Whereas if you look at Middlesex, actually had the most. They only had 8 communities with committees on aging, but they have only 25 municipalities. So that percentage is a lot higher. So in green are the counties on here that had the most percentage of their communities. So a more density of their communities had committees on aging. And then the blue, the ones highlighted in blue are the counties that had none, that we didn't find any. Not that they may have them, but we weren't able to find them in the study. And those are largely rural: Cumberland, Gloucester, Salem, and Warren. So 3 in South Jersey and 1 in North, but all mostly rural. All counties themselves, though, do have what they call senior center advisory committees that provide oversight for the county offices on aging. Those were not included in this because this was focused on municipalities. Go ahead. So what did we find out about some of the characteristics of the municipalities with committees on aging? There are 8 municipalities in New Jersey that have a population more than 100,000. That should be flipped. It should be more than 100,000. Only 1 actually has a committee on aging that we were able to find. The communities with committees on aging had a median population size of about 23,000, whereas New Jersey in general has a lot of really small towns that kind of skew that. So the median was 8,400. In terms of the percentage of population 65 plus, communities could have had anywhere from 6 to 50% of their community that's comprised of largely of older adults. But the median was 16.7%, which is very close to the New Jersey overall population of 65 older of 16.9%. Also, what we found was many communities with municipal committees on aging also have senior centers, 45%, but also many don't. So where do we go from here, Emily?
Thank you, Althea. Yes, so I'm going to just conclude briefly here to move on to our next parts of the agenda, but I want to reiterate that our scan for municipal committees on aging in New Jersey was designed as a pilot project to provide some preliminary insights. And so we think this area of research, practice, and policy is especially promising, given growing public and political will to enhance New Jersey's municipal capacity on aging. As one example of such growing will, I think it's important to note that the New Jersey's fiscal year preliminary 2024 state budget includes the introduction of a new state grant-making program whereby community leaders and municipalities can apply for state funding to spur age-friendly community planning and action. This is a promising development toward a more age-friendly New Jersey, given that our years of research has demonstrated the importance of grant-making programs for spurring meaningful, systemic, and sustainable age-friendly community change. Municipal committees on aging, though, are certainly not the only muscle that a place-based community can grow and strengthen to make its environments better for long and healthy lives. But we think it is likely across many of New Jersey's diverse communities that there's certainly these committees are within reach municipal structure for systematic progress toward age-friendly aspirations. And clearly this work is happening already in our state, and there's natural communities of practice that could be cultivated to amplify the efforts of these groups and expand their reach and impact throughout additional geographic locations in our state. So with that, I'm going to hand the mic back over to Althea to introduce two wonderful communities that are exemplifying being leaders and among the special group of 12% of municipalities in New Jersey that have these things in place already and that are willing generously to share with the class how it's going for the benefit of all.
So first up, I am very honored to call on Mayor Jaclyn Veasy from the very long-standing committee in Evesham Township, and Robert will be sharing your screen.
Good afternoon, everyone. We're just pulling up our presentation. As Althea said, I'm Mayor Jackie Veasy from Evesham Township, which our website, I'm proud to say, was the website that Annabess used as the example of how to find our board. So I'm glad our board was easy to find on our website. So I'm honored to be here with all of you today. This is a picture. We have a Senior Citizen Advisory Committee. And just on this first slide, I just want to share, these are some members of our Senior Citizen Advisory Committee, along with me on the right. So if you want to go on to the next slide, but I just wanted to show. So just a little bit of an overview of the Evesham Township Senior Citizen Advisory Committee. We were created in 1981, and it was used to research and recommend measures to meet the needs of Evesham senior population. I just want to say, because we've grown a lot since 1981, so our current population is, I think, officially around 48,000 residents. And we have a pretty large senior population in our community, but in 1981, we were much smaller. So the committee has gone through very different iterations over the years. And most recently, we just reorganized it in 2021. So the committee, as was said by Emily, it is appointed by the mayor for 2-year terms. So previously, we have 7 members on our committee. And previously to 2021, everyone was appointed to 1-year terms. And I just thought for better engagement by the members on the board, it would just make it a little easier if we had 2-year terms. So we split the committee in half, and half the committee gets appointed every 2 years. And the members can be any senior resident looking to give back to their community. And I will say that we have senior residents who give back to the community on various different boards. But this one specifically works to help benefit our seniors in our community. And I also try as a liaison to the board to attend as many meetings as we can. Our committee typically meets every other month, and we do have a community center. A lot of our senior activities happen at our community center, but the community center is not strictly a senior community center. I know one of the bullet points was that the senior community centers usually have a senior citizen advisory board, but we have a community center, but it's not necessarily a senior community center. If you want to go to the next slide. So what we do, the members of the committee use our meetings to discuss ideas and programs that they believe will help Evesham senior residents. So I became mayor of Evesham Township in 2019. And we do also have a senior citizen club, which is a social organization that's separate from the township. And prior to 2019, I would say that a lot of what the Senior Citizen Advisory Board did in conjunction with the Senior Citizen Club. So they were very intertwined. What I pushed for our committee to start doing with my leadership was to actually meet as a committee and work like one of our other boards to make recommendations and discuss with me and our department heads and our township manager ideas and programs that can help our senior population, because we have a large population of people who want to continue to live in Evesham and they had families in Evesham and they want to continue to live in Evesham, but now we need to make sure that we're providing services to them and offering programs that would be helpful to them in their current stage of life. This was also very important for us as we came out of COVID, which is what led to the committee being reorganized in 2021, is that we definitely saw the benefit of having the Senior Citizen Advisory Board to be able to talk about how we could support our seniors as we get back to quote unquote normal life after COVID, and how can we support them in any of their needs. So the committee members, when we are speaking, they'll talk directly to, like I said, myself and our other staff to give feedback and their insight on different things that they need around town. And one of the biggest challenges that any community would have is that when you're talking about senior citizens, you're talking about an age population that's 65, and you could have members, you know, all the way up to 100 living in your community or more. So of course, the needs of the senior citizens that are maybe 85, 90 or older is completely different from the needs of the senior citizens that are 65. And what I've also seen is that the members of the Senior Citizen Advisory Board who might be closer to the 65-year age range are looking to give back and would like to help the older seniors. So it's a good combination of trying to just have that discussion of how can we help each other? How can we make sure that everyone is being taken care of? And then, of course, discussion like that can lead to recommendations for legislative action to the governing body if it was needed. We haven't had to do that specifically in the last 5 years, but some of the things that we have done are make capital improvements to different facilities or parks in order to make sure that we're accommodating our seniors. Our committee members, because of their involvement, which is a benefit of anyone who serves on a municipal committee, they're able to improve their own mental and physical health because they're staying active, they're taking ownership of the changes that they're making in the community. And then, you know, you can see the result and you can say, like, when they're out with their friends in the community, what do you think we should be doing better? What can I relay to the mayor? What can I relay to our department head or our township manager that could make our community better for you? And it's really great to see the committee members working together on that. And just some of the great things that we've done over the last several years can lead to lasting changes and give a lot of information, including, and you can switch the slide. What our biggest project we've done is a Senior Citizen Expo. And like I said, coming out of COVID, this was done in 2021 to really get everyone out and looking at the services that are available to them. The Senior Citizen Expo was a combination of just different, Rob, you can go to the next screen. So the Senior Citizen Expo was an advisory committee event. They proposed it, we planned it in 2021. We had it at one of our recreation centers. And what it did was it brought together healthcare providers, senior living facilities, legal services, financial advisors, counties, agencies, municipal agencies. The Senior Citizen Expo was great for us in 2021 because we just had purchased a large open space park, and we used the Senior Citizen Expo as a way to engage with our seniors and say, what would you like to see in this park? And it was great for them to be able to interact and talk to our planning team that was working on that and give their feedback. And we've done that on several, we just had another Senior Citizen Expo last year, and we once again asked for feedback of what our seniors would like to see in our open space and all of our parks as we look over our open space and recreation plan. And what it did was it allowed our seniors to, one, get out and have an in-person event, which is very good for any seniors to be able to experience, as well as it was open to their families, which a lot of times when it comes to services for seniors, it's very good to have the families involved in it. And then it allowed our seniors to learn about services that are right here in the community. And now we've made it a yearly tradition. Everyone is looking forward to our Senior Expo. So we did it in 2021 and we did it again in 2022. And we're currently in our stages of planning our Senior Citizen Expo for 2023. You can go to the next slide. And these are just some pictures from the expo. As you can see, we had people from our clean communities, our public works, and just different vendors available at the expo for people to come and get information that they need. You can go to the next slide. More pictures for you all to see, because we thought you would enjoy some pictures. And then what I do like is if you see the children in the back with the red shirts, that's our Youth Advisory Committee. And what we try to do is really try to match our other committees together with our seniors so that they can work together. So our Youth Advisory Committee was there helping with the Senior Citizen Expo. It was great for everybody involved. You can go to the next screen. And then what the Senior Citizen Advisory Committee also does is it gives feedback on programming that we do. So this is a concert that was done for our seniors. If you go to the next slide, you'll see we also have a lot of other services that we provide that the Senior Citizen Advisory Committee gives us feedback on. So they look at our community center and look to see how we can help support the Senior Citizen Club that does meet monthly at the community center. We help hold senior citizen enrichment programs such as Tai Chi, Bocce, quilting, stained glass, watercolor, painting, yoga, and like I said, we ask our members for feedback on what they would like to see. Some very popular topics for discussion are Medicare, Medicaid. We did last year a fall prevention seminar, which was greatly attended, how to control diabetes and nutrition. We also provide transportation through our seniors that allows for grocery stores and retailers and medical offices. This was very challenging during COVID, and that is a big discussion that we had in 2021 with our Senior Citizen Advisory Board, with how we could get that program up fully operational again, so that our seniors could get out to our local grocery stores and they could get to their doctor's offices through that program, and making sure that it was safe for everyone. And then as we've been going and growing, our monthly casino trips have been very popular that get planned through our senior citizens department, special theater programs, and summer concerts and other seasonal activities that we have that go on through our community center. And all of these programs are all done through feedback that's given to us from our Senior Citizen Advisory Board when we meet for our meetings of what they would like to see and what they would like the community to try to provide for them. You can go to the next screen. And then these are just some pictures of things that we've done, like that's the Senior Citizen Club holiday luncheon on the left side. And then the one on the right is actually a picture from the fall seminar that we had. And the doctor was showing how to fall, how to get up from the falling. So, and you can go on to the next screen. And here's some more pictures. We have our summer concerts, which are very well attended at our community center. And then this is just a picture of our senior transport bus that we have for getting around town. And of course, the most popular thing that we have always is bingo. We love to provide the social activities for everyone in the community, and everyone loves to play bingo. So we share a picture of bingo. That's all. Thank you so much for listening to me. I hope that other communities are able to build their communities on aging or senior citizen advisory boards. It is a great asset for any community to make sure that we're listening to all the different age groups and really getting them to work together. And like I said, if you're someone who's looking to get involved in a committee, you can get involved in the Senior Citizen Advisory Board committee, but there's also so many other committees that interact with each other. Thanks so much.
Thank you so much, Mayor Veasy, for all of your wonderful leadership and for sharing what your community has done. If you're comfortable, if you'd like to put any contact information in the chat, if people have questions after this meeting, you're welcome to do so. Next, I'd like to invite up Laura Van Dyke from the West Orange Senior Services Department, as well as the Older Adults Advisory Board.
Wonderful. Thank you so much for that introduction. And I'm really thrilled to be here and really so inspired already, and just very appreciative for the opportunity to hear all about Mayor Veasy's success. So thank you for that, and we'll be looking to kind of take in some of your inspiration here in West Orange. So I'm Laura Van Dyke. I'm the director of our senior services program here in West Orange. So I'm employed by the township. My role today is it's kind of an exciting time in West Orange. And I wanted to share, we have a brand new older adult advisory board. So for those of you who might be thinking of starting one, I wanted to give you a little bit of our history and give a little bit of some concrete feedback on how we got to this point. So also our older advisory board, our chair, Sam Bernstein, is on the call, and he'll be in the breakout room later. So I think he has a valuable perspective as well that he could share. So West Orange is in Essex County, and we have a population of close to 48,000 people. About 30% of our residents are aged 55 and up, and residents age 65 and over make up about 18% of the population. And our governing body, we have a mayor and 5 council members. West Orange supports an age-friendly initiative. And in 2019, we received some grant funding that enabled us to hire a senior livability coordinator. So she and I started around the same time. And then in 2020, we became an age-friendly community designated by AARP. So those details, those elements really kind of came together to help really push our age-friendly initiative and kind of change the way we've been thinking about our older adults. So at that time, when I was hired, there was discussion, certainly murmurings from within the community of the desire for an older adult advisory board, but at that time, it really wasn't the right time for the administration. So through my work and the work of Dorothy Sanders from our, who was our senior livability coordinator, we tried in our own ways to kind of connect with the community to engage our older adults and really hear from them, because we all want to be heard. There's value in being heard, and that's the population we're serving. So, and that's the program we want to provide. So it was really well received with that kind of inquiry. So now this past January of 2023, West Orange welcomed a new mayor after 12 years, Mayor Susan McCartney. It's an exciting time of change, and noteworthy that it's our first female mayor after 160 years. So that's profound in and of itself. So her arrival kind of brought a new kind of perspective to this idea of the advisory board. Additionally, new council members were elected, particularly Susan Scarpa, who also ran on a platform specific to advocating for an advisory board. So those aspects really helped push things forward. And really from the time between winning the election and the inauguration, November to January, already action was being set in place. So our, as Susan was readying to take over as mayor, was meeting with the town clerk and our town attorney to just educate herself on what boards are out there. And our clerk helped supply information from neighboring towns with ordinances that as examples from which we could decide how ours would read and what the mission and purpose of our board would be. So Milburn, Montclair, and Mahwah shared their ordinances, from which West Orange then developed our own. So let's see here. So when one is deciding to form an advisory board, of course, important decisions that go into that are around the purpose, mission, membership, organization structure, and function of the board. So those are important aspects that a lot of thought was put into. And then also for us, as Althea alluded to earlier, for us, we really felt like the language was important, and we really wanted to use the terminology reflective of the reframing aging movement. So we moved away from the language of Senior Citizen Advisory Board, and we are called, our board is called the Older Adult Advisory Board. So that was a kind of a big area of focus for us. So as highlighted in Dr. Greenfield's presentation, this is an Older Adult Advisory Board, which is a liaison between our community. The goal is to be a liaison between our community and our mayor and our council members, and for which they would make suggestions and recommendations for programming and such. So technically speaking, in West Orange, the mayor, it's a 9-member board. The mayor chooses 4 members, and then each council member chooses 1. So it's a board of 9. And there was a real effort to choose a diverse group of council members that represent a cross section of the community. I think we've done a good job of that. The members include educators, lawyers. We have an older adult resident in their 90s, who's been a longtime resident and advocate in our community. We have an older military veteran with keen interest in veteran rights. So that was important. And just so to name a few, that's an example of who was on our board. And my role in the Department of Senior Services provided some consultation to some of those decisions on who was being, who the members selected, given my role and my access to community members. So let's see. So after the board was selected, the mayor appointed Sam as the chair, and he took the initiative to reach out to me and request an initial meeting, which I think really helped set the tone for our initial meeting in April. We've had 1 meeting. Our next meeting is Monday. So you really are catching us at a time of change and opportunity. And I think, Sam and I are, he's off to a good start as kind of really trying to work together to really use this opportunity in West Orange to just get better and stronger and support one another using this unique kind of access to the community through the board, and really using the model that Mayor Veasy suggested of really wanting to orient our programming towards what the direct needs are. And so in the breakout session, Sam and I can talk a little bit more about that process. And so I'm very hopeful. I think it's an exciting time. This is something the community has wanted for a very long time. And I think there's a lot of, administrative support behind it. And, stay tuned, because some of what's to follow, we're hopeful, and it's full of a lot of promise, and certainly not without some challenges, but none that aren't insurmountable. Just a natural kind of time of transition, and just navigating that, which one would expect. So I think I'll leave it there, and I'd just like to be viewed as a community that's open to kind of sharing the feedback of what's gotten us to this stage. And we look forward to kind of leaning on each other as we navigate forward, and really just look to have a great thing going here in West Orange.
Thank you so much, Laura, for sharing your journey, especially with how early you are. It's so great to see kind of both of those important pieces of how to keep a committee going, and also how to get one going. So thank you very much. We'll have a couple of minutes just for a little bit of Q&A, but then I want to be able to get into breakout rooms so that you can ask some more detailed questions in those rooms as well. Yeah, so I think in both breakout rooms we'll go into this in a minute, but Laura has an older resident who's on the committee in West Orange who will be joining in the breakout room, and as well as Mayor Veasy does too. So you'll be able to, whichever room you go into, you'll be able to also ask questions of people in those roles as well. So I saw a couple of questions. I think I saw 2 questions that I'm going to pose to the speakers, and pick whichever one you'd like to answer first. The first question was from Gina Marie, which was about whether there's been any consideration of disability and inclusion among all of these municipal committee on aging efforts. And then there was another question in the Q&A of whether any of your groups or in your towns have corresponding, like a friend of the senior center, such type of a group. I don't know if it's necessarily not with the senior center, but a group that could do fundraising to help support the work that you do. If either of you would like to speak to either of those 2 questions, I would invite you to do so.
Althea, I can answer. So we actually have a Disability and Veterans Advisory Board. So it's a separate board from our Senior Citizen Advisory Board. All of our boards work very closely together. We went through, I think it was in 2021, we were awarded an Inclusive Healthy Community Grant. So we have spent the last 2 years reviewing how we can make sure that the disability services are also included. But we have a separate board that really focuses on that, but of course they all work together. And then I forget what your second question was. Oh, if we have a fundraising group. We don't have a fundraising group that's separate. We have the Senior Club, which is a separate organization, and they can raise funds, but we don't use that for our purposes per se.
Love the idea of a fundraising group and would love to have more information on that. And what I will say is, in terms of the different issues and different individual needs, we're wanting to accommodate. So whether it's a older adult that's no longer comfortable traveling, then we want to solve that challenge. So there was an active effort to have a good cross-section of people in our community and meet any need that would, whether someone can't come to the meeting and then needs to attend virtually, we offered that at our first meeting. So there's a consciousness about it, is how I would answer that. Yes.
I'm going to chime in here too on both questions, just to kind of offer a research kind of big picture voice on both these really 2 great questions. So the question around the intersection between aging and disability, I think this gets at a core of how we're all kind of dancing around very similar systemic issues, but our kind of structures are very readily become fragmented or hard to navigate and disjointed. You just kind of layer on a lot of different groups, and it can create challenges with navigating it. And I think the key is not necessarily to do complete integration, but to make sure that that work is done more intentionally and aware of what the others are doing. And so creating kind of more intentional networks and points of connection, like whether that's having somebody from the disabilities committee crosswalk and attend the aging committees too, and vice versa. So there's this regular natural flow of information, and kind of structuring that to make sure that happens, I think is like one example of how these things can be aligned more strategically. We even have, the Inclusive Healthy Communities grant making program as one part of our state government. And now we're hopefully going to be introducing age-friendly grant making program. And how do those 2 things speak to each other at the state level in terms of the state's work on empowering municipalities to engage in these spaces and making sure those things aren't fragmented from each other as well. But the fundraising question, we've learned through our research, we're social work researchers. I'm a social scientist. I didn't get trained in public affairs, and I learned a ton from on the ground leaders on how these things actually work. And we've kind of come across this idea of like government instrumentalities, like senior centers, libraries, that kind of feel like they're very civically oriented, but they're not technically part of a municipal administration. Sometimes municipalities will create like a special account that's not of the municipality, but is a place where they can raise funds that help go for community programs. And so there's kind of this connection, but it's administratively separate. So they're able to raise certain kind of funds that they can't otherwise, as the way their municipality is set up. So these are all really important questions to be asking within the context of how your own local government is set up and what the stipulations are around what's allowed and what's not allowed, and what could potentially be workarounds for gaining financial capital and doing in a way that's going to benefit the big social cause, but making sure it's funneled in the right place administratively for that to happen.
Thank you, everyone, for your reflections on those questions. I appreciate all of these different perspectives, and I've seen a couple of other questions come in through the Q&A in the chat. I do hope that you can go and ask those questions in the breakout room, because it's time for us to open breakout rooms so that we can have a little bit more of an intimate conversation of the topic of your choice.
Welcome back, everybody. I don't know about you all, but I felt like we were just getting going in our breakout room and had so much more to talk about. So just want to thank everybody for their full engagement, and also, again, our speakers. As I have some additional concluding thoughts, I just want to launch the poll before people sign off. You should be able to see the poll. There's 2 open-ended questions. When we've done these events in the past, we've actually found that just getting your perspectives of what you're taking away in your own words is very, very helpful for our future planning and understanding of people's experiences. So the first question is, what is something new you learned at this meeting? And then the second question is, what is something that you are excited to bring back to your community or work? So if you wouldn't mind reflecting on that before we formally conclude here. And just want to reiterate, that leadership and innovation to make social change on aging is super energizing and exciting. I think that's why many of us are here today, but it also can feel like a very uphill battle or climb. And how important it is to continue to build these statewide networks with each other to learn more about each other's work, especially at the local level, amplify what's already being done and help bring others along more quickly and more intentionally. So do any of our other speakers or hosts want to offer any closing remarks, or others want to unmute and offer any closing reflections?
Well, I want to thank everyone for being a part of this session. And I know there's some resources that a few people have asked about, including the link to the North Jersey Alliance website and the events that are happening there. So I'm sure when we recirculate the minutes, we'll be also giving you contact information for everyone, as well as links to various websites that would be helpful. And if you can take another minute just to put in the chat what other information you would help with, we can certainly circulate that as well. But I want to thank you on behalf of the Grotto Fund, the Town Foundation, and all of our speakers today for being here today to further the efforts of the work that you're all doing to make our municipalities more aware of the needs of older adults and of the opportunities to work with our older adults to build stronger communities.
Thank you, Rini. Okay. Just want to say thank you again to those who prepared remarks and participated in breakouts. I think we're okay to conclude. Just make sure if you can answer those poll questions before you sign off. But I'm also happy to keep this room open for more kind of informal discussion with each other. Similar if we were in person together, people would catch each other in the hallway or have kind of informal talk. So for those of you who would like to stay and be part of that, we welcome you. And for others who are going to jump, thank you so much for being part of this again, and we hope to see you soon.